Good to see you, everyone. And briefly, what I'm going to do, I'm going to introduce myself, and then we'll talk about the idea behind tonight launching. Myself is Dr. Uthman Wali, consultant, assistant professor, vice dean of Ibn Sina National College, member of ITI and member of AID. At the same time, I'm the director of the ITI Study Club of Jeddah. The idea behind the ITI Study Club is that we'll have a scientific gathering here and there. The idea is to have 3 to 4 times per year to have a sort of gathering and share information. Kindly visit the website www.iti.org. It's not commercial, it's a scientific website. It's not related to any company. That's why we are here today. It's not related to Stroman or any, because it's part of educational institute, but not related directly to Stroman. It's related to implant in general. ITI, International Team of Implantologists, but it's not by us, but by any company. It's implant in general. And that's why I'm standing over here. I'm not franchising the implant system over here in front of us. I'm just introducing a new implant system, and we can discuss together the idea behind the new implant system to be launched in Saudi Arabia. Okay? www.iti.org. I really want to take the opportunity to thank Dr. Shomino. He's going to participate in Saudi Dental Society tomorrow in Riyadh, in the Saudi Dental Society meeting, at the same time King Saud University meeting. Tomorrow he will fly to Riyadh. Okay. We have different systems. I'm sure most of the staff over here in front of me, professionals, they are working with different systems. Okay. Today we'll talk about a new system, maybe familiar for some of you, to be introduced to Saudi Arabia. The idea behind the scientific part is to go through the topography. My voice is clear? Okay. Topography, micro and macro, okay? And we'll talk about the properties of the implant system, Axiom implant system. As Erwin covered greatly, he covered the history about the company. Let's talk about the implant systems. We have different brands and lines of products, but recently they have 3 lines. They call them Axiom, and then they have different types of implant systems, depends on the type and indications. They have Axiom REC, they have Axiom XP, and then the PX, and then the last one is the Axiom 2.8. Each one has different indication, different use, and can be used in different bone types, okay? The topography in general, they are the same, but they have macro structures differ from one implant system to another. Let's go through them one by one. Let's start with the Axiom REC. This implant system is for clinical practitioners. Any practitioner can use it, can work with it. It's a very safe type of implant system, concern the type of threads and the apical or apical part or the apex of the implant, because it's rounded. Okay, so it's أنا المشكلة يعني وقوفي هنا في شرح implant system is a little bit critical, but I'm just talking about general views of the implant system over here. Okay, so they have very unique structure. The threads are a little bit huge in size. That help engaging the bone. And one of the characteristic is the self-tapping. The implants are self-tapping type. They are drilling while placement or engaging bone while placement. They can be used by, as I said, by most of the practitioners. They are characterized by straight threads. Okay, the neck are very unique in a way that has a tip that can be, whenever we place the implant, we can place a subcrystal to grow the implant on the edge of the neck. At the same time, facilitate the process of platform switching. You are familiar with the idea of platform switching. Now, most of the implants, they are talking about platform switching to help the bone to grow on the top of the implant or the borders of the or edges of the implants, at the same time reduce the risk of bone loss. Okay, so the straight threads neck optimize the anchorage, okay, engaging the bone. At the same time, retentive for the neck of the implant. One point that I have to mention over here, the connection is also unique in a way that we have one connection that majority of the abutments can be used, okay, with different sizes with one type of size, which is 2.7, okay? They're cylindrical in shape. Most of the implants, they're cylindrical. The implants easy to be controlled and guided to the insertion because it's self-tapping type. The protocol of drilling is very simple. You can use one small kit that help you to place the implant and safely engage the bone. As I said, it's a self-tapping type. Very easy to compact the bone around the implant and engage the bone and facilitate the process of bone growing around the implant. As I mentioned, it's achromatic because the rounded tip. Okay, the new thing that the pack is very nice and modern in a way. We can get the benefits of color coding. So it's color coding, depends on the size of the implant that you're going to place. And you have the size written on the pouch or the box. At the same time, all the stickers are below the box. Okay, as I said, the connection is crucial that engaging in friction way, at the same time engaging the cylindrical hollow inside the implant, reduce the leak around the abutment implant connection, increase retention of the abutment. Okay, the implant system can be used in any type of implant, any type of bone, and the good thing about the connection that will reduce the stress around the implant. This is what they mentioned, that they have the connection inside, in the middle, and that will reduce the stress around the neck of the implant, subsequently reduce the bone loss around the neck of the implant. As you can see, they are conical, okay, and the direction of the threads are in certain angle which facilitate the process of engaging the bone, at the same time helping or facilitate the process of bone formation around the threads. So cylindrical and conical. And conical, a little bit if you can see the direction. Okay? Yeah, no, not cylindrical for sure. All the implants are cylindrical. And conical. Apex is narrower than the yes. Okay, one more point is that, as I said, most of the abutments are with one size, which is 2.7. So you don't have a variety of different connections that you have to pick up. Whoever concerned about the prosthetic part, they don't have a variety of connection. They have only one size, which is 2.7, but you have different Yes, not only emergence, the size of the abutment.